I'm Julie Soukup with our next episode of Take One Patient. I'm incredibly excited that I'm talking to Dr. Anthony Romeo. He is an orthopedic surgeon at Duly Health and Care, as over 90 providers that are doing surgery for patients there. And a few articles that he's written and his expertise about patients' complications really intrigued me. And so I asked him to be a guest on our podcast, and we're going to talk a little bit more about that today. So thank you for being here. I'd love if you kind of took a minute to introduce more of the depth and breadth of your experience before we get started.
Sure. Thank you, Julie, for the opportunity to speak with you today. I'm the Executive Vice President for the Musculoskeletal Institute at Duly Health and Care. Duly Health and Care is now currently over 1,000 providers or physicians. And within that group, 90 of the physicians are related to the management of musculoskeletal problems such as orthopedics, spine, rheumatology, and neurology. And my particular interest is in the field of orthopedics with a special expertise in shoulder and elbow surgery. I've been president of the Shoulder and Elbow Society in the United States, and I've had a big role in much of the teaching and education related to shoulder and elbow over the last 25 years. And that's really where my patient population comes from in terms of the care that I provide on a daily basis for those patients.
Fantastic. Well, I think one of the things that really interests me in our conversation that we were having previously, and in a lot of the articles that I've read that you have written, really dealt around patient complications and not only how to handle communication with your patients and their families after the fact, but also how to really ensure that you're kind of setting expectations and setting things up from the very, very beginning. So tell me a little bit kind of where that, especially as far as that beginning piece of setting expectation of where some of these articles and some of the need to kind of get that information out to other providers stemmed from with your experience.
As you go through your career, you take on more and more advanced and more complicated issues, not only with patient care, but also with patient management. And I think it's really important to pay forward, but also to pay back. And that is that and someone in my position with the experience I have, I can share with my peers and also the younger physicians some of the challenging experiences I've had with patients, which are opportunities to try to do a better job in caring for those patients. And probably one of those areas that really affects all of us in the healthcare delivery system is when a patient has a complication. And a complication really can be defined as when the outcome of the treatment was not what you and the patient expected. And typically it affects them in a way that's a negative result. And so the ability to speak with your patients about that is really important. And it begins from before the treatment actually starts. And so, like with any relationship, one of the most common reasons why relationships fail is the failure to meet expectations. So the important thing is to start from the very beginning to set the expectations. And we kind of have this idea that we want to under-promise and over-deliver. We don't want to tell patients that, oh, this is 100% of the time you're going to do great and nobody ever has a problem, because that's just not life. Yeah. The only way to avoid complications is if you don't operate in terms of surgery. And so we have to have that discussion up front.
Well, and it's interesting that you're even talking about that and using that word as a discussion. Is, we had a previous guest who was a doctor and a lawyer, and he was really talking about how informed consent, which is where you're supposed to go over risks, benefits, and alternatives, how it really needs to be a very thorough dialogue about, okay, this is what this is, but these are some of the things that you're looking at kind of walking into and really setting that expectation, setting that tone from the beginning.
Well, I can tell you that when you speak to anyone that has a legal background, they're going to give you this perspective that you have to have this laundry list of things that you have to do to protect yourself if something happens. Right. And that's one approach. But the other approach is to develop a relationship with the patient where they know that you are doing everything you can to help them get better and they trust you. Right. And if they trust you, you're not going to have to worry about whether you hit every single thing on that laundry list every time, because
Right.
you are working with that patient in a relationship where they know you're going to do everything you can to make it right. And I think that's the best place to start from the perspective of a provider. And then I think it's helpful to have experts in the legal field tell us, well, this is the checklist of things that you really also want to keep in mind.
Yeah, absolutely. Well, it's interesting even that you are saying that, because one of Medical Memory's biggest clients is Barrow Brain and Spine, which is also like scheduled surgeries. And so
Yeah.
they have created a bunch of videos that are the like informed consent videos that go over risk, benefits, alternatives, everything under the sun in a very simple way that they can send to patients very simply and track the patient's had that. But that's what they're saying is then it allows me to know, okay, I have given them all that information that I need to. Now I can focus on our communication and our trust, because I know kind of that piece has been covered, with Medical Memory. So it's
Right.
interesting because they had kind of a very much aligned, we have to cover both, but I need to invest that 10 minutes or invest that extra time I have to making sure that we're connected and making sure they trust me and making sure that we're building that kind of relationship from the beginning, just as much as the legal part.
Yeah, I think there's a lot of different approaches to it from the legal perspective, and I'm not an expert in the legal world, but I can tell you there's some attorneys who will tell you don't want to put every single thing you can think of, because the one
Right.
thing that's not on there, they'll say, well, you didn't include this, and that was the
Sure.
problem. You
Right.
really want to present the perspective that you inform the patient of the most common challenges and problems that can happen with this type of surgical intervention, and that there's ways around that or managing those things if they need to happen, but you should be aware that this can happen. And again, setting those expectations, but really more than anything else, you have to get the patient to trust you. And
Right.
one of the really important viewpoints that a physician has to have and remember every single time is that patients do not care how much you know until they know how much you care. And I
Absolutely.
think it's really important you develop a relationship with your patient where they say, this doctor cares about me. He's
Right.
going to do a surgery. And then if something doesn't work at the end, he's more likely than not, they say, you know what? I know you did your best. These
Yeah.
things can happen, and we'll work through it together.
Sure.
Certainly, there's times where there's a liability, and we want to cover that. And I don't want to downplay the importance of that. But for someone who's been in practice for almost 30 years and has not been in the courtroom related to these issues, I think that developing a relationship with your patients is your best approach to malpractice, and then let the attorneys advise you on the other paperwork and other things that can be helpful.
Sure. Well, and so that being said, is let's talk, because of the other article that you had written, and I thought that you had so much great advice of, is okay, so now we have gone through surgery and now there is a complication. What advice, and so whether that be the physician that actually had the complication or even a physician that's being referred to, which that was one of your specialties, is a lot of times you're being referred. What are some of the things that you really encourage physicians to think about in terms of communication when there is a complication on their own case, let alone someone else's?
I really have a broad experience with this, because not only do I have my own complications occasionally, hopefully as minimal as possible, but as you mentioned, because of my position in this community, more than a third of my patients come to me have already had a surgery that did not result in the outcome that they expected. And many times they're upset, frustrated, or just clearly angry about the way things went. And so I have to manage that not only for myself, but also for the referring physician in terms of how to take care of that. And I think that the British Medical Society has a concept which they call the Duty of Candor. And I think that's an important concept too. And that is, you've got to be honest, and you be as honest as possible. And that is, you try, in my situation, in taking care of these patients, first of all, this is the problem that you have. This is what I believe is the best way that we can manage it going forward. And this is what we expect the outcomes. And immediately the patient's going to want to go back to, well, why did this happen? And who's at fault? This is typical human nature. And the real key to our care for these individuals is to say that our focus needs to be on how we can take care of your problem and get you out of the situation that you're in here and get you into a better place. and we'll work with you to try to get that outcome much closer to what you expected. But it's important, again, to develop the trust. The patient knows that you care for them, that you're going to give them hope that there's going to be a better outcome, and you're going to do everything you can to try to make sure and execute going forward with a plan that's going to actually make that difference for them.
Right. Well, and I appreciate how much you talked about, really staying focused on the future, saying, especially when you're the new physician that's potentially revising something else, of being, I don't know. I'm not an expert. I wasn't in the surgery, but let's focus on today and our relationship and how we're going to move forward. And that I'm going to, providing hope and saying, let's just keep this future focus. Let's keep this focus on what we're going to do about it now. Which I think is profound, and also, based probably on a lot of experiences in that situation.
I think patients oftentimes do have a natural tendency to want to place blame. For me, the important thing is to validate their concerns and say, you know what, you do have a problem. It's a real problem. It is not what was expected from your surgical procedure. And I'm sorry that this happened. And I know that it's created a lot of challenges for you in terms of pain and inability to use your limb or to have the functions you want. Right. But let's think about what you initially presented with, what happened, and how we can get you closer to that expected outcome that was talked about before your surgery. And I think there's some ways we can work on that to help you out with that. And I do appreciate that this is a really tough problem for you. And I know that you've had to deal with it for a lot longer than our visit together. But I would like to focus on, I've got this problem. How can I spend as much energy as possible in figuring out how to give you the best solution? And I think that really does help the patients have a sense of that, okay, the doctor's listening. He knows that I've had this real issue. He's not discounting it as being something that just can happen randomly, but actually it really was a problem. And in addition, he's helping me figure out what's a better way to get to where we'd like to go. And that's really important for them.
Right. Now, when you do have a patient that has been referred to you and they are continuously going negative or continuously mad or angry, I mean, how do you pull them kind of out of even that space, or that just their emotions are really high? Like, how do you manage that?
Mm-hmm. I think, again, it comes back to developing that relationship of trust. I think one of the most important things is that the physician has to be willing to listen. And there's so much about being present, being mindful in terms of relationships in general. And when you sense that this patient's really angry and very negative and really wants to kind of dig in, the most important thing to do is just be quiet and listen. Let the patient have their moment. Let them say what they need to say, even if it really is a complication somewhere else, but give them a chance to express themselves. And it's sort of a cathartic event for them to get that out to the doctor. The doctor listened to me. And it takes another few minutes to do that, but it will be helpful. If they continue down this path of just negative all the time, sometimes you have to say to the patient, I can understand why you're so upset. Right. I can't resolve your anger, but if everything is going to be about how disappointing and how angry you are and how upset this is, we're going to have a really hard time focusing on how to get you to a better place. And right. So I appreciate that this is an important feeling and emotion that you have to have. But while we're here together, let's try to figure out where we need to go so that right. we can alleviate some of the problems that you're dealing with.
Right. Well, and I think that was really it is amazing to say, kind of like, I'm going to give you, grace in this space, and appreciate the fact that, like, you're not shying away from the emotions that they're truly having. Because, often, they have maybe a reason to be upset, or they are in a lot of pain, and they're definitely not living the life that they thought that they were pre-surgery. And so allowing that outlet or that grace to just allow them to have it allows them to move forward, it sounds like.
Well, it may sound a bit awkward, but in fact, when that happens, I try to find a closer personal space with that individual. And that means if I'm standing up, I'm sitting down.
Yeah.
And I'm face to face with that person and I'm right in front of them. And I want to have eye contact and let them say what they need to say.
Right.
Because I think that it's so valuable to allow them to share with you how they truly feel, even if it's very negative and angry, that if you give them that moment, if you give them that grace, that's going to make a big difference in the trust that they have for you and your ability to get closer to the outcome that they were expecting.
Right. And so for even providers that don't have the experience that you have, or have done it kind of for as long, it sounds like sometimes even the best two things that you can do is just get quiet and pay attention to your body language. And you don't have to say it all or defend anything. It's almost just like get quiet and get closer, or pay attention to kind of the nonverbals that you're having.
Yeah, I think it comes back again to the fact that, and I think when you're younger in your profession, there's a sense of that, well, I need to prove to this patient that I know what I'm doing and I can take care of this problem. I'm smart enough to figure this out. I've seen this problem. We'll figure it out. And again, just remember, they don't care how much you know until they know how much you care. Establish that sense that you really care for them. You're listening to them. You're understanding their problem. And when they're ready, then you say, okay, now that we're in a better place, and you don't have to say that, but you want to sense that they're now listening to you. Here's your problem. This is why I think this happened. This is how we're going to try to solve that problem. And these are the steps going forward. And I think you can be very successful in helping manage that patient with that type of approach.
Right. Well, and as you had said in your article, is one of the best thing, even if you were the physician that had the complication, is being honest, 100% direct. This wasn't what we expected. This is what's happened. But it also is apologizing, and that apologizing isn't necessarily meaning that you're admitting guilt or admitting that there's that fault or admitting, well, I told you before, or any of that. It's just more so kind of bringing you both to the same level of just saying, I'm sorry that this is happening. And how it can really kind of calm both people.
Yeah, that was really an issue as a human being. When you see someone hurting or suffering, you want to say, I'm sorry.
Yeah.
I'm sorry this is happening to you. And unfortunately, in the legal system, there were places where that was picked up as, that person is guilty. They said they were sorry. They must be guilty. Fortunately, the vast majority of states have passed laws that say when you apologize, you're not admitting guilt. Right. And that is the most appropriate thing. I think one of the things that really people don't understand unless you're in our position is that when a patient has a problem, when they have a complication, it hurts us too. It's very difficult on us too. Most of us have been driven to try to be the best student, the best doctor, the best surgeon. And if we do something and it results in a bad result, it's very, very challenging for us in terms of our own egos, in terms of our own mental health, to just accept that, well, that's the way things go. It really bothers the vast majority of us in a way that I don't think all the patients really understand. We think about it at night. We think about it when we're working on other things. We always talk about the fact that when you take an exam, the one question you remember is the one that you miss and the ones you get wrong. It's the same here. You could do 100 shoulder replacements and one patient gets an infection, which can happen in 1% or less. And it will drive you crazy figuring out, gosh, did we make sure that the antibiotics were in on time? Did we do the proper prep? Did we make sure that we washed the shoulder out very carefully after the surgical implants were done? And everything can be perfect, but I think patients should understand that for us, it is also a secondary injury for us. And so I do want to say when they have a complication in my patient, I'm sorry this has happened, but here's what this issue is. And here's how we're going to help you out. So I'm sorry, and I apologize. I do understand what the problem is, and we've dealt with this before, and I'm going to give you hope that we can get to a much better place than we are today.
Right.
And that's my goal when I have to address a complication in one of my patients.
Right, right. And that's one of the things in that same article that I thought was interesting, is that even if it does have to get referred to another physician, is making sure you're not abandoning that patient and being almost lean into engaging more in their care versus, okay, that's your problem now, but leaning more into ensuring that you're still a part of that process even as they go, and that it's almost an element of healing for both even with that as they are being referred out.
Yeah, in my practice, I've reached a level where many of those cases are referred to me, and so I take care of that end stage. But there are occasionally the rare problem, like for instance, a neurologic injury where a nerve may have been injured in a way that wasn't seen at the time of surgery, wasn't necessarily cut, it just doesn't work anymore.
Yeah.
And they need to have some of these unique modern procedures like a nerve transfer. And that's done by very specialized people that do microvascular surgery that I don't do tendon transfers and tendon grafts. So I've got to refer them out to that. But I tell the patient, listen, this is your problem. This is the individual who specializes in this in a very high level. And I'll call them and tell them what happened and explain to them so you don't have to worry about that. And then give them my recommendation and work with them to come up with the best plan to treat you. It's really important, again, care for your patients, listen to your patients, and stay involved with their future care, even if it goes to another provider, so that you can make sure, again, that the patient realizes this doctor really does care about me and is doing everything they can to get the best result.
Right. Now, for the one thing that you speak so much about is making sure that you're building that relationship and making sure you're taking that extra little bit to have time and whatnot. So one of the things that I thought, for a lot of our providers are like, gosh, I'm just so busy, I'm overwhelmed. Sometimes I don't have that extra 10 minutes or whatever that might be. That's where a lot of physicians that we encounter start using video with medical memory, or even recording these visits with medical memory so that patients still have more access to it. But that being said, is one of the things that I thought was really awesome that you were talking about was it's not just you building that relationship and that communication, and that you had talked about, if you're not having the time, is really leverage your team and have a true team approach to making sure that patient has a great experience. So talk to me just a little bit more about how you do that and ensure that your team really has that same value that you have in patient communication.
In 2022, everybody thinks that technology is going to solve all of the problems in healthcare, and including the relationships between the doctor and the patient. So more video, more digital, more handouts. That is not the answer. That is the assist to what needs to be done. The answer is still the relationship between you and your patient. And so, yes, if you want to put videos in, sure, you can do that. But really, the more personal it is, the more human it is, the more effective it is. So you have a physician assistant, you have a medical assistant, you have a receptionist, your surgical scheduler, maybe the radiology technician. All of these people are interacting with your patient. And your patient needs to feel like the team is focused on their care and is trying to figure out how to do the best thing for them. Yeah. And so what's important is that you, and in this situation, if I have this group that I work with on a regular basis and I'm sort of the captain of the ship, we need to find time, preferably once a week, to sit down and go over things. What did we do well this past week? What did we have some problems with? And let's look at our cases going forward next week, particularly with our surgeon's schedule. We like to look ahead and do that. And we meet together as a team and we talk about these things. And they'll say, Mrs. Smith had a really tough time and she was not happy at the front desk. And I'll say, well, how did you manage that? Yeah. And I want them to be concerning and concerned and listening and helping them out. And I want my physician assistant, and I want to have the whole group working towards that patient feeling like we're here for them. And the real insight to healthcare in the future, the way it's going to work is whatever we do, we put the patient at the center. And if we do that, no matter what the technology is, we keep putting them at the center, we'll come up with a better answer. There's no doubt that technology is going to help us, but it's never going to substitute, never in my lifetime, for the relationship between the people that interact with them and that patient.
For sure. And it's so interesting you say that, because with a lot of the orthopedic or even neurosurgeons that we work with, it also goes to, you only have so much time. And so if you only have an hour or a certain amount of time with a patient, is how do you want to utilize that? And I think that that's what becomes really profound when you are using resources like video, or we're using, recording the conversation so that a patient can review this awesome experience that you're having together and review like the connection and seeing that trust being built later. It allows the provider to be like, I know the educational piece was covered. I know my patient's not going to call back because they have a recording of our dialogue. So now I can just truly just have this extra 5 minutes, less worried about all the education or all the other pieces, and being able to focus it more. And so just as I think you said it really beautifully, it's never going to replace that human interaction. But I think technology, especially as it relates to patient education, patient video, takes some of that burden that still evolves for some providers on, I have to cover everything and I got to make sure they're educated and I got to make sure that I don't have the risk. That, okay, there's these tools that are in place. So now that you have that 5 minutes, you can focus more on that trust and on building that, and have these resources that exist that will help support patient education in that process. And so for a lot of our physicians, when they're recording, telling a patient for the first time, you have neurosurgery, you have spine surgery, and they're able to be in that moment with them, when family members are watching it later, they're like, gosh, that provider really cares about you. And it's building that trust equity for everybody. It's because the provider's like, I know that they have these other pieces. Now I get this extra time, there. And so I think that's where technology really can support more, is it provides more time, in some spaces. So that we can focus on that.
I think all your comments are entirely appropriate. And so for me, again, not everybody has the ability to have all of the technology that you mentioned, but if they do, it's wonderful. And there's no doubt that the patient satisfaction, patient experience is improved, and we should all work towards that. But for me, again, it begins with putting the patient in the center, developing a trusting relationship with them, and then bringing all this together with the people that you work with, the technology you have available. So certainly recording it is very valuable, but if you had no personal relationship with that patient, if you didn't develop a trusting relationship with that patient, if you didn't have the ability to have candor and honesty, if you didn't have the ability to show that you cared for them, that video is actually detrimental. And so again, we start with that centerpiece, and I think it's a wonderful time for our profession and healthcare, but also the patients, to use technology to really expand the experience beyond what people have had in the past. But start with the core principles, and then add some of these wonderful technological advances that we have, like you've mentioned, videotaping the experience. And I think it'd be wonderful, you videotape the experience. The patient has access now through a number of different mechanisms to their own medical records, to their own radiological studies. And it's also a nice thing that you can do for your patients. And I've done this. I have a very intelligent patient that wants to know what's going on the MRI and shows that. I say, here, take your phone out for a minute and just stand over here. And I'm going to, in the next 30 to 60 seconds, I'll show you on this MRI, here's what it is. It's this, this, and this, and explain it to you. And then you have a record of that, and you can show that to your family members. So these are wonderful, wonderful advances that we have to have. But the reason why I have the opportunity to share that with my patient is because they trust me, and they know that I care for them, and they know I'm going to try to do a really good job. If I don't do that first, they don't care what I say on that video. So everything you said is absolutely correct, and really just makes an incredibly more fulfilling patient experience if you can put all of that together.
Right. And that's why I think it's amazing hearing a lot of your experiences when things are a little hard and are a little stressful. So for some of the people that are wanting to use these things, but they're not as comfortable because they haven't kind of learned some of these things or had a complication. Oh my gosh, what if this happens? And a lot of your experience and your expertise and your true like values, I think really shines in a lot of these articles that you're writing. And then as far as a lot of this, as far as building that trust equity, ensuring that candor, and really leaning in there first, because 100%, if that's not there, it doesn't matter anything else. All of it's noise if you don't have that piece first. With all your experience that you're still coming back to that, probably, which is why you got into medicine, is pretty amazing. So I so appreciate your intellect and your experience, and I think it's a lot of the things that you have mentioned are incredibly valuable for a lot of people that are wanting to really take their communication skills to the next level to implement some of these things. So I so appreciate you so much for joining. Is there anything last minute that you kind of want to add?
Yeah. People make the comment, it's the practice of medicine, and that's what it is. It's the practice. You can't sit on the sidelines. You have to be on the field of play to manage these challenging problems, and you have to move into it with grace but confidence. And just remember the principles. Show the patient you care about them by listening to them. Come up with a reasonable solution, even if that means somebody else. And make sure that they know that you're going to follow through with this and make sure they're okay. And if you can add the technological advances and enhancement that you mentioned, it's going to be even that much more fulfilling experience for your patients. But the worst thing you can do is become intimidated by the process and walk away and not try to help that individual. That's the worst thing you can do. It's really the time to dig in and be the very best doctor that you can. And it will pay off. It will be the right thing for both you and the patient. It will also help you heal inside when these things happen in your own patients, which is a very challenging thing for many of us to manage.
Yeah. Awesome. You're great. Thank you so much for all your wisdom. You're just a wealth of knowledge, and I so appreciate your time.
Thank you for the opportunity. I really appreciate it, and continue to do a great job with what you're working on.
All right. Thank you.
It's going to make a big difference, and I think it's wonderful. Thank you.
Awesome. I appreciate it.